Welcome to Healthcare Channel. Vitamin D is an essential nutrient that plays a vital role in maintaining healthy bones, teeth, and muscles. It also helps regulate the immune system and supports brain and nervous system health. However, many people worldwide are deficient in vitamin D, which can lead to a range of health problems. In this video, we will explore vitamin D deficiency symptoms and how to address this condition. Bone and muscle pain. Vitamin D plays a critical role in maintaining bone health by promoting calcium absorption. When you are deficient in vitamin D, your body cannot absorb enough calcium, leading to weak bones and muscles. This can cause bone pain, muscle weakness, and an increased risk of fractures. Fatigue and weakness. Vitamin D deficiency can cause fatigue and weakness, which can significantly affect your quality of life. Low vitamin D levels have been linked to low energy levels, leading to chronic fatigue and exhaustion. It can also contribute to feelings of weakness and make it difficult to perform daily activities. Mood changes. Vitamin D deficiency has been linked to mood changes and depression. Several studies have shown a correlation between low vitamin D levels and an increased risk of depression. This could be because vitamin D helps regulate the production of serotonin, a hormone that affects mood. Increased risk of infections. Vitamin D plays a critical role in supporting the immune system and fighting off infections. When you are deficient in vitamin D, you are more susceptible to infections such as the flu and respiratory tract infections. Vitamin D helps produce antimicrobial peptides that kill viruses and bacteria, so a lack of vitamin D can compromise your immune system. Hair loss. Vitamin D deficiency has been linked to hair loss. Vitamin D plays a vital role in maintaining healthy hair follicles, and when levels are low, it can lead to hair loss or thinning. Studies have shown that individuals with alopecia areata, an autoimmune disorder that causes hair loss, have lower levels of vitamin D than those without the condition. Slow healing. Vitamin D is essential for maintaining healthy skin and aiding in wound healing. D deficiency in vitamin D can slow down the healing process and lead to chronic wounds. Vitamin D helps produce compounds that support the growth of new skin cells. Without it, wounds may not heal as quickly. Bone deformities in children. Vitamin D deficiency can lead to bone deformities in children. A condition is known as rickets. Rickets can cause bone pain, muscle weakness, and bowed legs. Vitamin D is crucial for children's bone health as it helps regulate calcium and phosphorus levels, which are essential for building strong bones. Difficulty thinking clearly. Vitamin D is important for brain health and cognitive function. Studies have shown that low vitamin D levels are associated with poor cognitive performance, including difficulties with memory and decision-making. Vitamin D helps regulate the production of neurotransmitters, which are important for brain function. Cardiovascular disease. Vitamin D deficiency has been linked to an increased risk of cardiovascular disease. Low vitamin D levels can contribute to high blood pressure, heart disease, and stroke. Vitamin D helps regulate blood pressure and inflammation, both of which are important factors in cardiovascular health. Increased risk of cancer. Several studies have shown that low vitamin D levels are associated with an increased risk of certain types of cancer, including breast, colon, and prostate cancer. Vitamin D plays a role in regulating cell growth and division, and low levels may contribute to the development of cancer. Respiratory problems. Vitamin D deficiency has been linked to respiratory problems such as asthma and chronic obstructive pulmonary disease, COPD. Vitamin D helps regulate immune function in the respiratory system, and low levels can contribute to inflammation and respiratory infections. Increased risk of falls and fractures in older adults. Vitamin D deficiency is a common problem in older adults and can contribute to falls and fractures. Low vitamin D levels can lead to muscle weakness and instability, increasing the risk of falls. Vitamin D is also important for bone health, and a deficiency can lead to an increased risk of fractures. Impaired wound healing. Vitamin D deficiency can impair wound healing and increase the risk of infection. Vitamin D helps regulate immune function and supports the growth of new skin cells, which are essential for wound healing. Low levels of vitamin D can lead to delayed healing and an increased risk of infection. Increased risk of type 2 diabetes. Vitamin D deficiency has been linked to an increased risk of type 2 diabetes. Vitamin D helps regulate insulin production and blood sugar levels, and low levels may contribute to the development of diabetes. Increased risk of autoimmune diseases. Vitamin D deficiency has been linked to an increased risk of autoimmune diseases, including multiple sclerosis, rheumatoid arthritis, and lupus. Vitamin D helps regulate immune function, and low levels can contribute to inflammation and the development of autoimmune disorders. Vitamin D deficiency can lead to a wide range of symptoms and health problems, including bone and muscle pain, fatigue, mood changes, increased risk of infections and cancer, respiratory problems, and impaired wound healing. It is important to speak with your healthcare provider if you suspect you may be deficient in vitamin D, as supplementation or lifestyle changes may be necessary to address this condition. Thanks for watching. Subscribe now for more information.